Hey guys, welcome to my channel Not Just a Medico. I'm back with another video of important questions in general surgery. In this video, you'll get all the important questions of this subject. It contains maximum questions that were repeated in your previous year question papers. So I can assure you guys that you'll not just pass but you can easily score distinction in this subject. But only if you prepare thoroughly without skipping any of the question. And here the questions are given chapter wise for your easy understanding. Before beginning with the video, let me tell you all that there might be few printing mistakes or there might be few questions that are missing in this printout. So I'm going to dictate all the questions so you can write it down for your reference. Now without any further delay, let's get into the video. As you can see, the first chapter is about fluid, electrolyte and acid-base disturbances, and it includes all the topics that is mentioned here. I'm not going to read out these topics in each chapter, but you can check it out for your reference. In this chapter, the important 10-mark questions are: the first one, write an essay on general post-operative complications and its management. Second one, describe the indications and complications of blood transfusion. Third one, explain in detail the steps involved in wound healing and what are the factors that affects wound healing. Next, write about different phases, mechanism and factors affecting wound healing. Now, moving on to the important 5-mark questions. The first one, basic process involved in wound repair, complications of blood transfusion, factors affecting wound healing, what is scar and write its types and management, types of skin graft, phases of wound healing and hemostasis. Now, coming to the important 3 marks. In this, the first one, types of scar, types of tetanus, factors affecting bleeding during surgery, name the postoperative complications, mention two difference between hypertrophic scar and keloid scar, complications of blood transfusion, respiratory acidosis, treatment of anaphylaxis, name the phases of wound healing, define ulcer, keloid and swelling, ascites, keloid, mention four classifications of transfusion therapy in surgery, MMR vaccine, factors affecting wound healing, what is gas gangrene, types of wounds, and name two blood components and their uses. Next, we have few more important 5-mark questions of the same chapter. Types of anesthesia, hemorrhagic shock and its management, define acidosis and alkalosis and describe about their management, tetanus, basic process involved in wound healing. And there is one more important 3-mark question, that is causes of metabolic acidosis. And that's all about this chapter. Now moving on to the next chapter, that is reasons for surgery. In this, the important 10-mark question is write an essay on abdominal incisions. Coming to the important 5 marks, incision of abdomen, tubes used in surgery, types of abdominal incisions, local anesthesia, MRI, biopsy and its uses and types, drainage system and tubes, endoscopy, McBurney's incision, types of skin flap, surgical infection and biopsy, its uses and types. Now coming to the important 3 marks. The first one, biopsy, its types and uses. Next one, colonoscopy, indications of bronchoscopy, indications of biopsy, MRI, endoscopy and its types, skin graft types, types of scar, what is biopsy, types of suture material, intercostal drainage and its indications. Now moving on to the next chapter. In this, the important 10-mark question is define hemothorax, describe etiology, clinical features, investigations and management of hemothorax. Now coming to the 5 marks, pneumothorax, hemothorax, pneumothorax and its surgical management, what is cardiac tamponade, list the causes and explain hemodynamics. In 3 marks, the first one, what is aortic disruption? Second one, what is diaphragmatic disruption, esophageal disruption, airway obstruction, causes of airway obstruction, and hemothorax. Now coming to the next chapter, that is surgical oncology. In this, the important 10-mark question is define cancer, write the types, clinical manifestations, stages, and surgical procedures involved in management of cancer. Now coming to the important 5 marks, the first one, describe staging and management of cancer. Second one, staging of cancer. And in 3 marks, we have only one question, that is TNM classification of cancer. Now moving to the next chapter, that is disorders of chest wall. In this, the important 10 mark questions are: the first one, empyema thoracis, its clinical features, diagnosis and management. Second one, lung abscess, its clinical features, diagnosis and management. Third one, carcinoma of breast, mastectomy. Fourth one, bronchiectasis, clinical features and management. Next, in 5 marks, we have mastectomy, lung abscess, TB, its management. Next, emphysema thoracis, its causes and management. And tension pneumothorax, difference between intrinsic and extrinsic asthma. TNM staging of lung cancer, pleural effusion, tracheostomy, and pulmonary edema. Next, coming to the 3 marks. The first one, define bronchiectasis. Second one, emphysema thoracis, chest wall deformities, lung abscess, tracheal stenosis, X-ray features of pleural effusion, tracheostomy and its indications, define lung abscess, repeated again, rib fracture, indications of tracheostomy, mention the complications of bronchopleural fistula, congenital tracheomalacia. And there's one more important 5 mark question, that is carcinoma of female breast. Now coming to the next chapter, that is disorders of heart. In this, the important 10 mark questions are: the first one, mitral stenosis, management of valvular disorders. Second one, congenital heart disease, clinical features and management of tetralogy of Fallot. Third one, classify congenital heart disease, write a note on Fallot's tetralogy. Again it is repeated, so you can mark it as very important question. Now coming to the 5 marks. The first one, coronary artery diseases and its management. Second one, patent ductus arteriosus, ventricular septal defects and its hemodynamics, explain in detail. Mitral stenosis, VSD, that is ventricular septal defect. Next, acyanotic congenital heart disease, its types and management. Mitral valve stenosis and its clinical features. Now coming to the important 3 marks. Name any 4 congenital heart diseases: coarctation of aorta, tetralogy of Fallot and its clinical features. Next, congenital heart disease, it is repeated again. Next is CABG, cardiac tamponade and its clinical features. Myocardial infarction, murmurs and mitral stenosis. And with this, we are done with this chapter. Now moving on to the next chapter, that is thoracic surgeries. In this, the important 10 mark questions are: the first one, define pneumonectomy, details about indication, physiological changes and complications. Second one, what is CABG? Describe the procedure in brief, indication and contraindications for the same. Define thoracotomy. What are the incisions used in thoracotomy and explain any one in detail. Next, CABG. Explain open and close heart surgery, complications of CABG. Next, congenital heart disease. Explain tetralogy of Fallot in detail. Write about indications, clinical features and management of appendicitis. Now coming to the important 5 marks. Decortication, lobectomy, thoracotomy, its definition, types of incision. Valvotomy and valve replacement. Thoracotomy, repeated again. Heart transplant, pulmonary edema, signs, causes and symptoms. Cushing syndrome, cyanosis and mention its causes. Next, pleurodesis. Now coming to the important 3 marks. The first one, thoracoplasty, segmentectomy, pleurodesis, complications of heart transplant, what is CABG, pneumonectomy, decortication, indications of lung transplant and mention its complications, cardiac arrest, complications of kidney transplant, pleurectomy, thoracotomy, it is repeated again, and lung contusion. Now moving on to the next chapter, that is diseases of arteries and veins. In this, the important 10 mark questions are: the first one, write an essay on etiology and pathogenesis of atherosclerosis. definition, type, etiology, pathogenesis, clinical features, and management of pneumonia. Third one, describe etiology, pathogenesis, and surgical management of varicose veins. Next, in 5 marks, we have first one, superficial venous thrombosis, atherosclerosis, Buerger's disease, DVT, varicose veins, aneurysm. What are the types of ulcer and what are the signs of venous ulcer? Blue boaters and pink puffer, pulmonary embolism, and pleural effusion. Next, in important 3-mark questions, the first one, types of aneurysm, drainage tubes, Raynaud's phenomena, hypertension and its types, conservative and surgical management of PVD, MMR vaccine, lung abscess, dyspnea, and pulmonary embolism. Now, moving on to the next chapter. In this, the important 10-mark questions are the first one, define hernia. What are the types of inguinal hernia? Describe anatomy of inguinal canal and management of inguinal hernia. Second one, write about definition, indication, incision, physiological changes, and complications of nephrectomy. Next, in 5 marks, we have nephrectomy, gastrectomy, prostatectomy, colostomy, femoral hernia, inguinal hernia, BPH, that is benign prostate hypertrophy, indications of nephrotomy and its types, clinical features and management of leprosy, appendicectomy, what is nephrectomy and indications of the same, what is colostomy and write its indications and complications. Next, coming to the important 3-mark questions. The first one, types of hernia, cholecystectomy and its indications, nephrectomy and its indications, write the clinical features of cholecystitis and mention its surgical management. Appendicectomy, its types and indications, hernia, and write about any 4 types of hernia, clinical features of appendicitis, 3 complications of hernia, incision of appendicectomy, causes of biliary stones, clinical features of cholecystitis, and gastrectomy. And 2 more important questions that are not mentioned here are umbilical hernia, second one, indirect inguinal hernia. It can come for 5 marks. And there is one more important 10-mark question, that is, what is nephrectomy? Explain about its indication, physiological changes, and complications of nephrectomy. Now, moving on to the next chapter, that is burns. In this, the important 10-mark questions are the first one, what is burns? Classify it and mention its clinical features and management. Second one, write in detail the classification, clinical features, and management of burns. Third one, discuss epilepsy under its types, diagnosis, and treatment. Fourth one, define and classify burns. Describe the management of 30% of thermal burns. Clinical features and management of patient with 30% burn. Write the classification and management of burns. And the last question is, write the assessment and management of patient with 30% burns involving chest, bilateral shoulders and arms. Next, coming to the important 5 marks. The first one, types of flaps, types of skin graft, flaps, muscular dystrophy, types and uses of flaps, facial burns, types and uses of skin flaps. It is repeated again and again, so you can mark it as very important question. Now, moving on to the 3 marks. The first one, Wallace rule of 9. Second one, uses of flaps, skin graft. What are the types of skin grafts? Mention the donor sites for skin flaps. Problems of low birth weight in infants. Define autograft. Name 2 complications of it. Types of scar, types of skin graft, and Wallace rule of 9. And this chapter ends here. Now, moving on to the next chapter, that is related to women's health. In this, the important 10-mark questions are the first one, describe stages of labor, its follow up, complication, and management of labor. Second one, describe the stages of childbirth. What are the surgical procedures involved in childbirth? Third one, what is incontinence? Mention its types, causes, and management of stress incontinence. Last one, draw and label the abdominal incisions and add a note on hysterectomy. Now, coming to the important 5 marks. First one, rectal prolapse, Second one, hysterectomy. Define urinary incontinence, its types and management. Stress incontinence and its management. Menstrual cycle and its disorders. Childbirth and its surgical procedure. Define incontinence and mention its types. What are the causes of management of stress incontinence? The last one, write in detail about carcinoma of breast. Now coming to the important 3 marks. The first one, phases of menstrual cycle. Second one, preeclampsia, dilation and curettage. Name the 3 prenatal infections. Endometriosis. What is incontinence and write the causes management of stress incontinence. Hysterosalpingography, colposcopy, hysterectomy, prenatal complications, preeclampsia, effects of menopause on musculoskeletal system, types of incontinence, stages of labor. And no, guys, this chapter doesn't end here. I know it's quite a big chapter, and I know at this point some of you might feel like these are too many questions, but trust me, guys, if you compare it with the syllabus, these are very less questions. But I can say that these are way more enough to not just pass, even to score distinction in this subject. But the key is you should prepare all these questions thoroughly without missing any question.
3, 2, 1.
Okay, now let's continue with the remaining 5 mark questions. The first one, sterility and its investigations, menopause, its effects on musculoskeletal system, uterovaginal prolapse and its causes and types. Write a note on maternal changes in pregnancy. Write in detail about physiological changes during pregnancy. And as you can notice, there are many questions that are repeated in this chapter. Hence, this chapter is very important. Menstrual cycle, mastectomy, laparoscopy, and its advantages and uses. Last one, episiotomy. Finally, we are done with this chapter. Now, moving on to the small chapters. There are last 2 more chapters that are very small. As you can see, it is related to ENT. As you can see in this, there are no important 10 mark questions. Coming to the 5 marks, the first one, chronic suppurative otitis media, otosclerosis, and as you can see, it is repeated again, so you can mark it as important question. Coming to the important 3 marks, the first one, define tympanoplasty, give 2 indications of it. Otitis media, what is otosclerosis, and sinusitis. Now moving on to the last chapter, that is ophthalmology. In this, there are no important 10 mark questions. Coming to the important 5 marks. First one, glaucoma and its management, conjunctivitis, ptosis and its management, retinitis and its management, glaucoma, and corneal ulcer. Coming to the important 3 marks. The first one, define iritis and give 2 causes of it. Types of squint, what is cataract, types of glaucoma, ptosis and its management, glaucoma, iritis, corneal ulcer, conjunctivitis, and retinitis. And finally, we have come to an end of this video. If you find this video helpful, then do not forget to like, share, and subscribe to my channel. If you have any video suggestions, then do let me know in the comments below. I'll see you guys in the next video. Till then, take care and bye-bye.